Good morning and welcome to the Morning Spotlight. My name is Mike Ham. I'm a sales executive for Fidelity National Title Group. Today, our guest is founder and owner of Recovr Acupuncture and Sports Rehab in Nutley, New Jersey, and one of my best friends, Dr. Alan Genitempo. Al, how you doing today?
I'm good, Mike. How you doing, buddy?
Doing great. Thanks for coming on, man.
Yeah, of course.
So tell us about Recovr.
Yeah, so I started Recovr Acupuncture and Sports Rehab in April of 2019 after finishing graduate school of my doctorate program. I see people here usually for pain management issues, people aging, people between the age of 30 to 65 with, low back, neck, knee, shoulder, pretty much anything you could think of. What acupuncture does, it helps heal the body and physical ailments without drug intervention. I'm not against drugs, but I'm more of a proponent of the body's pretty resilient. Let's see what we can do, prior to going that route. So it's a great pain management alternative to opioid medications and other sorts of medications. That's what I mostly do here on a regular basis.
So tell us a little bit more about what acupuncture is, the benefits of it, and all that.
Sure. Yeah, this is a common question I get asked every single day. So what acupuncture is, it's using these stainless steel needles to cause what's called micro traumas to help heal the healing process. So think of trauma on a bigger scale, like spraining an ankle. Okay. So when you sprain your ankle, a lot of times what happens is that ankle gets big and swollen, red, hot. Your body's basically saying, don't touch it, leave it, let it be. So that's trauma. So what I'm trying to do is micro trauma. So like the needles go in, the body suspects there's something going on, and it starts sending blood and lymphatic fluid to that area to help the healing process. Now, blood also carries oxygen, and oxygen is one of the prime feeders of our muscles and our joints. So we need sufficient oxygen all over the body. So acupuncture really helps promote oxygen flow, blood flow to the area, and helps the healing process. So that's kind of it, that in a nutshell. It's kind of my most basic kind of explanation of it. But it can help.
The Cliff Notes version.
Yes, that's Cliff Notes version. But it can help for a lot of different things too. I do pain management mostly, but it's been proven scientifically to help with fertility as well as gastrointestinal issues, and insomnia and anxiety and things of that nature, headaches. So there's really no bounds for what it can do, because it really affects the nervous system in such a significant way that it affects everything else. So that's kind of like you said, my Cliff Notes definition for what it does. It's kind of easiest to explain to people.
Awesome. So I know you touched on it a little bit, but who would be a good candidate for your services?
Yeah, no. So I see people that, get hurt running down the street or have been in pain for 20 years and they've just never really addressed it. So I see both acute and chronic pain cases. I really enjoy seeing the chronic pain cases because it's amazing how people kind of, see results after a certain period of time. The kind of like light bulb goes off in their brain, and it's just kind of a cool experience to see, treating those types of people. But, I'm a big sports guy. This, we played baseball together. I love seeing cases. I see cases of all different kinds, post-surgical rehabilitation, you get the weekend warrior going out and doing CrossFit. Yeah, it's such a mixed bag, and every day is different. So it makes working fun. No two cases are ever the same. So it's something I really enjoy to do, and I love helping people. So
awesome. So obviously people have had a lot of concerns over the last couple of months. What are some concerns that they've expressed to you?
Yeah, I mean, some of the concerns I've seen are just more general safety, and how I'm going about taking care of, people and what I'm doing to help prevent further infection. A lot of people I've spoken to tend to be more in the elderly range, and they do address the concerns of, they haven't left their homes in a long time, and is it really safe to? And, my biggest thing is reassuring people that it is safe. And what I do is I think it's important. I use social media as an avenue to kind of relay that to people, as well as I use MailChimp for my patients. just to send them messages on a regular basis. And what I've been doing, I only see one patient an hour, which I usually see around 3 an hour. So I moved it to 1 an hour. It gives me about 30 to 40 minutes with the patient. And then afterwards, I can clean the room, disinfectant spray, Lysol wipes, all that before the next patient comes in. I've hired a company called First Defense Sanitization, I'm sorry. And what they do is they come in and they spray Clorox disinfectant using this machine. It's called a deatomizer. And it basically like electrifies the room. So the particles of the disinfectant stick to surfaces. So further killing, any sort of particle in the air, bacterial, viral, that can cause issues. I also have a cleaning service here regularly. I think since March 14th, I've had my cleaning service in 4 times. So usually I do once a month. I've had them pretty much every 3 weeks now, just to keep things going. I have HEPA grade air filters here with UV light. Like I said, I use Clorox wipes. I use disinfectant spray. I'm regularly cleaning the office at all times, wiping down all surfaces and handles and doorknobs. And I'm masked. I'm masked always. I sometimes use gloves. It's not a requirement, but I do have hand sanitizer all over the building. I'm just taking every precaution, and I'm also showing the people that too. That I am taking those precautions, and there's nothing really to worry about. This is as clean can get
Right.
in this office, and that's been my goal every day since opening. But more so, obviously, in the recent times, I've been more so staying on top of that. So, but yeah, and then for patients, the only requirement is I ask them to wear a mask too. I show them that courtesy, and they show me the same. So,
Right.
but it's just about minimizing the rate of infection, and I think that's something that could be done in a setting like this.
Absolutely. So for everybody watching, if you want to learn more about Alan and his business, I'm going to put our contact information as always at the end of this video. Also be sure to check out our Tuesday night virtual happy hours to connect with some other great people. Al, thanks for coming on with us today. I really appreciate it.
Yeah, Mike, it's my pleasure.
And everybody else, thanks for watching. Stay safe. We'll see you next time.